Well, hi, everybody. My name is Greg Olsen. I'm the director of the New York State Office for Aging. I'm so excited that you're going to join us today or be watching this in the future. You know, we've had a lot of really great programs over the last 14 months where we do these Facebook Lives, but I am really excited for today. And I will introduce my two guests formally a little bit later, but I have with me today Dr. Nirav Shah and Alexandra, and we'll call her Alexand Drane, and I'll introduce them in a second. Like I said, this is really exciting. What we're going to talk about today is caregiving. And that's a term we use on the inside, but we're going to define what it is so that you know exactly what we're talking about. If you help anybody by mowing a lawn, shoveling snow, doing minor home repairs, providing transportation, making medical and other types of appointments, talking to a pharmacist, a doctor, somebody in a discharge planning unit, a physician's assistant, helping somebody shop or prepare meals, pay bills, or provide hands-on care, which is things like bathing, dressing, personal hygiene, helping with medications, you're a caregiver. And so this is really for you. That's what this is about today. That's how we define caregiver. Anybody helping anybody else, regardless of how intense or non-intense the task is a caregiver. Most people don't use that term and they think of themselves in a very different way. Their spouses, their adult children, their grandchildren, their grandparents, their parents, their friends, and their neighbors, and they're simply helping somebody that they love. Caregivers are everywhere and they're every age. It's not an older issue, it's not a younger issue, it's across every system, every age group, every culture, and every ethnicity. Some take on simple tasks first and then take on more as their loved ones' needs may change. Others get thrust into these roles due to a health condition like a stroke, a broken hip, or a cognitive impairment. There are 4.1 million of you out there in New York State at any given time during the year. And try to wrap your mind around this. You're providing 2.7 billion hours of unpaid care every year to your loved ones. That if you had to pay for that at the market rate, which is normally comes out of Medicaid or private pay, would cost about $32 billion a year. And you're thrust into the largest group that's providing long-term care in this country, that are providing healthcare follow-up and monitoring on behalf of the health systems. You become social service experts and so much more in these roles. Your value really cannot be overlooked, and supporting caregivers is a priority for not only this agency, but for our state. And engaging caregivers to be part of the healthcare system is really critical and an important next step. There are, of course, many, many positives that come from someone caring for another, but it also can be very demanding and stressful at times, especially if the tasks become more intense. COVID certainly did not make any of this any easier. And there's really been some important and startling data that have come out that I think should be a wake-up call for all of us, not only for those who have been working in this space for a long time, but for those that haven't. This is an all hands on deck approach. New York is a national leader in supporting caregivers of all ages, whether it be the first to implement the paid family leave program in New York, to investments in caregiver supports and respite across multiple agencies. That's why under Governor Cuomo's leadership, we recently won a national award from the SCAN Foundation and the AARP, but there's always more we can do. There's always more we should do, and there's more that we are doing. So like I said, I have two amazing individuals with me today to talk about this issue, to share their experience and expertise, to demonstrate why we should not only be paying attention to this, but ways we can make positive changes to support the critical roles that caregivers play. At the end, we'll talk about our First in the Nation project that we just launched to better understand our state's caregivers, to support them, to help them take care of themselves physically and emotionally, and to link them to resources that exist all throughout New York State and ways that we can provide cross-system support. And what that means is simply, regardless of where you work, where you live, where you've retired, what you do, again, this is an issue that we're all paying attention to and have a solution for. So let me first introduce Dr. Nirav Shah, who's a medical doctor. He's a senior scholar at Stanford University School of Medicine in the Clinical Excellent Research Center. He's also the Chief Medical Officer for Share Care Incorporated out of Atlanta, Georgia. And if the name rings a bell, it should. He was the New York State Health Department Commissioner not that long ago before he moved west. So Dr. Shah, great to have you back with us. in New York via Baltimore, but we'll take it. So welcome. And of course, we have Alexandra Drane, Alex, who is the co-founder and CEO of ARCHANGELS and Rebel Health. We've been doing a tremendous amount of work with Alex, has an amazing array of experience and expertise. And I'd say the three of us also have a tremendous amount of energy. So this should be a lot of fun. She is great at what she does. And she's really been a great friend to me personally and to this agency and this effort. So Alex, welcome to you as well. I'm going to start with you, Alex. ARCHANGELS, it's a cool name, right? If you see it somewhere, you're going to have no idea what it is and what it means. Tell me about what the name is, but more importantly, what's the mission of ARCHANGELS?
So I think the mission is related to the name. And Greg, you and I have talked about this a lot. Thank you for the introduction. Thank you for the enormous honor of being here. Thank you for the incredibly unique way you and your office, what you're doing to support unpaid caregivers. Because one of the biggest challenges with unpaid caregivers is they don't know they're in that role. They don't think of themselves that way. They are just a son, just a daughter, just a neighbor, just a friend. And so really the reason we named ARCHANGELS is when you use the term caregiver, if it resonates with someone, if that brings to mind all the tasks you just described, awesome, use that term. But for a lot of people, that term has confusion or even some stigma associated with it. And so we wanted a name that was aspirational, that made people feel like a badass warrior angel, like spreading their wings over the person that they're caring for. Because anybody who's been an archangel or a caregiver or had someone caring for them knows that the system often feels like it's fighting you in the role that you're doing. And these archangels are vital in getting people to the support that they need and getting folks to feel good about their role. So the term archangels is all about being aspirational. You are extraordinary in what you do, and we see you. And ARCHANGELS as a movement and a platform is all about reframing, therefore, how these incredible caregivers are seen, honored, and supported. And we do that using a combination of data and stories with a goal of getting people connected to the extraordinary resources like those in New York that exist, but they're not as utilized as they could be by people who don't see themselves in that role. So if we can get folks to feel not just destigmatized, not just normalized, but hey, any unpaid caregiver out there, you rock. We see you. What you're doing is work. It's amazing. We love you. And here are resources that exist to help you.
Yeah, I think that's important. And, you mentioned data. And so we know that, 55%, so over half of people that wind up doing any or all of these types of tasks, they don't use the words we do. So they're not going to self-identify. I talk a lot about the culture that we grew up here in the United States where we don't ask for help. It's frowned upon to do that. We're very crisis driven. But let's get back to the data. Again, this is not unique. People are dealing with this in isolation because they don't know where to go, or they're at a point where they can handle it now, but maybe not later. This isn't a new issue. Why is it so important now? What's some of the data that has come out really since the pandemic that I think should not only frighten us, but frighten us into action. So not frighten us in a negative way, but say, look, this is a big deal. And we're all, it's a community problem or issue that needs a community solution. So yeah. What are some of the things that really jump out to you?
I love when you say frighten us to action. We were interviewed recently and said, we found this data horrifying and heartening. And the reporter said, how can you say heartening? And we said, because any caregiver who's lived this experience will not be surprised to know the extent upon which that is impacting their mental health. What they will be surprised to know is they are not alone. And that in and of itself is care, right? That's going to help reduce anxiety and depression. So before COVID, beautiful AARP study that said about 23% of adults in the US are in this role. As of COVID, a recent study we published, co-authored with the CDC, 43% of adults in the US are now in this role. We have another national survey that looks at it, it actually pegs it more like 66%. So 40 to 60% of us are now in this role. Of those who are in this role, a full 70% are experiencing at least one adverse mental health consequence, anxiety, depression, or TSRD. But Greg, you and I have talked a lot about, we know that a lot of caregivers are actually in more roles than we imagine. For example, 23% of adults in the US right now, 23% are sandwich generation caregivers. That means you're caring for someone under 18 or people under 18, parent or guardian, at the same time you're caring for somebody or people over 18. The rate of suicidal ideation for the US at all who's not a caregiver is 4.5%. If you're only caring for somebody under 18, it's double, it's 9%. Only over 18, 10%. Greg, I'm going to ask you this statistic because you know it and I want you to say it. If you are in a sandwich generation role, so that's 23% of adults in the US right now, what percentage of us are actively, seriously considering suicide, having serious suicidal thoughts?
Right, and that's really scary. It's 52%.
Yes.
And generally of the caregiving population, it's about 30% versus what you had just talked about. So, I mean, that is the type of data that leaps off. So caregiving, again, there's a lot of tasks associated to it, but it has a healthcare impact and it has a mental health impact. So Dr. Shah, it was so great to see your name again. You went out to California. You and Alex put out a co-authored report in the New England Journal of Medicine called How Health Systems Can Care for Caregivers, which is really so important because, a lot of the times when we're working on addressing social determinants of health and providing services in the community that are not clinical, it's really hard to engage with hospitals and health systems and physicians' offices because they've been so siloed and maybe don't understand what each other does. But I was so pleased to see this report because this is exactly the kind of the bent that you were taking is, look, we got to get on the same page here and understand what some of this data is showing. So can you highlight what some of the key things were that you found and some of the recommendations that you think we really need to be working on, whether it's in the age-friendly health systems space or just some of the interagency work that we do so that we can, again, bring more assets to the table like the healthcare industry to recognize, identify, and refer and support.
Greg, thank you so much for having me and letting me speak with you and my good friend Alex on this. What we were lucky to do is we got the attention of the editors of the New England Journal of Medicine, Catalyst, which is one of the more prestigious journals in healthcare. And they focus on things that can improve quality, lower cost, really focus on healthcare. They do these surveys of hundreds of healthcare leaders, senior clinicians, and others, and try to understand an issue from the clinical perspective. What caregiving has done so well is really get it well known among the social services. What health plans, health providers really haven't looked at caregiving as their issue. This was one of the first and most important reports that showed just how big the opportunity is for healthcare providers to own the space of caregiving and co-own the opportunities and interventions. So one of the non-surprising things we found was that there's a giant disconnect between doctors' words and their actions when it comes to caregivers. 83% said that doctors believe caregivers, family caregivers, should be a part of the care team. And yet today, they felt only about 23% actually saw caregivers regularly as part of the clinical team. Now, remember, you're seeing a doctor 4 times a year. How many times are you being cared for by your caregiver the other 365 days a year? Mm-hmm. And yet you're not necessarily part of the clinical team. So there's that one disconnect between they want caregivers as part of the team, there isn't. Another was it's pointing fingers. Who's responsible? Do we have enough staff? What's the problem here? Well, obviously we don't have enough staff, right? The issue is, I'm a doctor, I'm so busy. We need more social workers. 52% said we need more social workers. We don't have strategic commitment across the organization. 44% believe that we don't even have that. And then of course, time. Time is the limiting factor. 37% of doctors said, I just don't have time to do this. Even though I know it's the right thing to do, I'm spending all my time clicking on the electronic health record, doing other things. This is just yet another unfunded mandate, even though they know the clinical team should include the caregiver. I'll stop there.
Yeah, and it's interesting because it's the same thing we deal with like personal care and home health aides that are in these homes every single day, but are not part of the clinical care team. So those who see the individual the most, understand them the most, understand the home environment the most, are those who are least likely to interact with professionals, where if they had that knowledge base, can make a tremendous difference.
Well,
Tell me what.
Greg,
Yes, I'm
really
sorry.
quickly, one of the things that you said in the beginning is anyone who's listening, anywhere between 40 and 60% of you yourselves are unpaid caregivers.
Mhm.
And when we talk about the population that Nirav was just talking about, I love you, Nirav, it's a huge percentage of those doctors, nurses, respiratory techs, home care aides themselves are not only on the front line providing essential care, healthcare, they themselves are also unpaid caregivers.
Right.
And we see about doubling the effect of all those scary statistics we just went through if you are in both of those roles. So I think about these beautiful doctors and I'm like, oh my gosh, we got to put our own air mask on before helping others, right? So I think part of what Nirav has been working on so hard is by building this awareness for these providers, not only do we hope that they will start this conversation with their patients and their patients' caregivers, but that they will take a second. We know the idea of saying to someone, take time for you is a joke. Anyone who's unpaid caregiver is like, ha, 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 when? Well, at the least you can know you're supported. We see you, and here are resources that exist that you can use when you've got the time.
Yeah, and that's critically important. And I believe Kelly put the systems care report from the Journal of Medicine into the chat, so folks can see how robust the survey data is, but also what some of the recommendations are. And we'll make sure that we get that out as well. One of the buzzwords is value-based care, value-based payments. So can you talk about, from your perspective, what that is, but really more importantly, how that can impact a caregiver positively?
Yeah, so I like to say that in the US today, we have a perfectly designed $4 trillion healthcare delivery system. It's perfectly designed to deliver more and more health care. It's not designed to deliver more and more health. But what is it what people want? Health, not necessarily just more healthcare. And in the old world, what we call the fee-for-service system, you got more and more healthcare delivery, not more and more health. So let's say you're in a hospital, you fall out of bed, you break your hip. What does the hospital do? They get paid even more for fixing your hip, and more and more. And so you got more and more, and that's why the escalation cost. So for the last few decades, there's this thing called value-based care. Like, there's got to be a better way. We got to keep people healthy. We got to go upstream. We don't just pay more and more for services. We want outcomes. We want to care about, are you actually doing better? And so for the example of the hip replacement, today, a hospital in a value-based contract says, you get $25,000 for the hip replacement. That includes all the prehab services, patient education, the surgery itself, post-hab, and 90 days after. So if you need another surgery afterwards, you still only have that $25,000. So you better be incentivized to take good care of the patient, make sure that patient goes home to somewhere safe, and make sure that they don't get readmitted. So this is now starting to change the equation. What unfortunately has happened is that when you only get $25,000, the first thing you do, all value-based care contracts, bundles of care, the first thing you do is you shift care and shift costs from the hospital to unpaid, non-unionized family caregivers. And that means a 4-day hospital stay becomes a 1-day hospital stay. And good luck with that daughter who's flying in from 3,000 miles away to take care of your dad when he got his hip replaced. You'll have to take a week or two off from work, and I hope you make it. That's the first initiative. The hope is that we can start to see the light and say, this is not good for anyone. It's not good for the patient. It's not good for the hospital. It's not good for the family caregiver. And we can actually do things to care for the caregiver as part of that value-based bundle that will ultimately improve outcomes for two people, the patient and the family caregiver, and lower total cost of care for both. And so that story that you can actually do better and do good simultaneously for the caregiver and the patient by focusing not on the patient, but by focusing on the caregiver, That's a new concept for healthcare. We don't make things for family caregivers, we make things for patients. And this is the opportunity where value-based care, oh, you've already built all these social determinants of health programs. Well, redirect them from focusing and intervening and asking questions around the patient to focusing and acting and intervening around the caregiver. You're doing a 24-hour post-discharge phone call from the hospital. You should also do a 72-hour post-discharge phone call to the family caregiver to see how you can help them. And so these are new concepts and ideas that if you do it right, you can actually achieve the triple aim: higher quality, lower cost, scalable. And by the way, that's in everyone's interests.
Greg, we don't have a Bic lighter. Hold up your phone, baby. Like, yes, preach, love, could not agree more. Thank you. And to every person who's been in that situation and then had to quit their job, their kids do more poorly in school, their relationship goes to crap, because maybe it's a hip replacement, maybe it's something that lasts longer. The impact on the top and bottom line of the state is huge. And that's why, Greg, again, thank you so much for recognizing, and Nirav and I are here to support in any way, shape, or form. It ultimately falls on the state. It falls on the nation. When these unpaid caregivers have to quit their jobs, go back into the person they're caring for goes back in the hospital, they often end up in the hospital because it's a very real impact on your health.
So this is the next work we have to do together, Greg and Alex. I hadn't thought of this. We have to figure out how to create these incentives. Sorry, I'm talking over you. We have to create these incentives. Today with value-based care contracts, they're like, okay, hospital, you're responsible for A, B, C, D, and that includes things like readmission rates. Well, let's add a bullet saying you're responsible for caregiver outcomes when you're doing value-based care. And that means you need to, number one, measure it, ask about it, track it, and then do something and intervene about it.
Yeah, and then measure how that intervention works.
I love this because what you're talking about from supporting caregivers from the clinical side and value-based payments and value care is exactly right. What we've known from the work that we've been doing for the last 50 years in the community is that's where the heavy lift is, right? As you mentioned, if you're in a hospital for a day, 2 days, 3 days, or whatever it might be, and it dwindles, it's more complicated, it's more complex. Where's the heavy lift? It's from the caregivers, and it's from the network of services that we provide. So I think you're right on the money. I love the direction and trying to integrate and incentivize to actually make it happen where the health systems aren't holding on to all the dollars and shifting the cost is certainly, I think, exactly right. So again, we had talked about in the beginning or in the opening, this isn't a new issue. Some of the data that Alex had presented from the fall and the spring, which again, I think Kelly is putting those links in the chat so people can see, really was able to measure COVID's impact, which I think is beyond distressing. Dr. Shah, from your perspective, how did COVID make things worse from the clinical side of the street?
Well, COVID made things better and worse. So better in one sense, it took 10 years, people joke that 10 years of payment reform couldn't do what 1 month of COVID achieved. All that unnecessary care. You're coming into the doctor's office for X and Y and Z because they can bill for it. Suddenly it's like, no, I don't want to see you. You don't need to come in, right? Well, all the telehealth that we know we want and need. Overnight, we got interstate contracts. Doctors can practice across state lines. I can see patients at their convenience without them taking a day off from work in a half hour by telephone and get paid for it. All of these things happen. And that was wonderful for caregivers and patients. And in fact, at Stanford, where I practice, we went from 0% primary care visits to 75% primary care visits done by telehealth in 3 weeks.
Wow.
The pendulum swung, but the pendulum has swung back. And now we're down to 10 to 15% almost everywhere. At least it's not zero. But the problem is all those regulations are going away as well. When the emergency orders around COVID expire in New York and elsewhere, people are doing rest stop visits because I can only see people in state as a telehealth provider. That means there are people driving from Vegas across the state lines to a rest stop in California so I can legally see that patient. That's real. I mean, imagine what poor caregivers have to do now with multiple states and all of these things, all the goodness that went away in just a few days. So that was the good in the sense of the telehealth reform. The bad is all the things that Alex talked about, the mental health burden, the overnight shifting of thousands of patients out of nursing homes into unprepared family caregivers' arms. I mean, these are things that were something that we, you'd like to think hindsight's 2020. We should have avoided, but we did nothing to support them. And this isn't going away anytime soon, folks. We really need to step up and start to do it. And to your credit, New York State is an age-friendly state. That is a big step in the right direction, but there's a lot more we can do.
Yeah, agreed. So, Alex, it's a perfect tee up, right? We're talking about the healthcare impact, talking about the mental health impact. We have yet to talk about the economic impact, but I think we'll get there at the end. So you guys developed what's called the Caregiver Intensity Index. Tell me what it is and what it does.
I'm sitting here listening to you guys. I want to describe it in the context of a human. And Greg, you and I talk about this all the time, right? Statistics are people with the tears wiped away. Behind every single horrifying statistic we just shared, the heartening part is there's attention getting to it, to Nirav's point, but is an individual, a human in their home. And how are people coping with these extraordinary stresses that are being put on them? As of COVID, for unpaid caregivers, we're seeing a 5 times increase in the use of drugs or alcohol to cope. 5 times the increase. And I will tell you, as an unpaid caregiver, that is definitely true for me. I absolutely, in some situations, I was caring for 4 beautiful people. It's now 3 because one of them died. And on nights that I'm super stressed out, if I have the luxury of not having to get up in the middle of the night to deliver a medication or check on somebody, I absolutely love a little bit of alcohol. Sometimes maybe a little more. Why? Because I'm so stressed out. We see that if you can't do that, you cope by overeating. 50%, Greg, you said this before, 50% of unpaid caregivers cope through eating. So the Caregiver Intensity Index was developed over 20 years, believe it or not. We've been doing this forever. And originally we focused on the overlap between caregiver stress and financial stress, relationship stress, workplace stress. Because anyone who's an unpaid caregiver knows caregiving is the epicenter of what we call life sucks disease. When you are an unpaid caregiver, all of these other impacts start to happen. When we started ARCHANGELS, we said, you know what? We want to focus purely on that unpaid caregiver. We think they are the backbone of our country. They are our country's most underutilized, underappreciated asset. They should be getting paid for what they do. The ROI on an unpaid caregiver is huge. How do we start delivering data in an actionable platform that first and foremost helps a caregiver feel seen and validated in their reality, understands what are the drivers of their intensity, what are the things that are helping to alleviate that intensity, and how to crosswalk them over to these incredible resources that exist. But if an unpaid caregiver doesn't know about them, they're not utilizing them. So what the Caregiver Intensity Index is, you can think of it like a quiz, right? A big head of HR called it a Cosmo quiz, which for a 49-year-old woman, I took a lot of Cosmo quizzes growing up. Absolutely. What it tells you is you go through 22 questions. It's also been described as like a mini therapy session, because over the course of these 2.5 minutes to answer these 22 questions, you get a score between 0 and 100. And you're in the green or the yellow or the red. And that in and of itself, you're like, oh my God, I hadn't even realized the extent to which these things were impacting me, right? So it's incredibly validating. And I can tell you that if you're in the red, there's a 49% negative impact on productivity. But the good news is, if you are in the red and you are employed and your employer is supporting you, work serves as respite. So anyone who's listening, if you're worrying that unpaid caregiving, when awesome people like Greg and the Office for Aging put in place Paid Family Medical Leave Act, don't worry that all your unpaid caregivers are going to run for the door. They're not, because for them, going to work is actually a place where they can do other work and feel supported in other ways. And we see a 20% lower risk of anxiety or depression for these employed unpaid caregivers who are in a workplace that's supportive. So just incredible reminder to all of you, right? What you're doing is incredible. Take this survey, find out if you're in the green, yellow, or red, pass it on as often, as frequently as you can, because you know most people are in it. And Greg, I have to say one more thing, because we can't say this enough as part of the work we're doing together. You started with just help. We always say, don't ask, just help. If you yourself are lucky enough to not be in this role right now, and I don't want to, unpaid caregivers are awesome. What they're doing is beautiful. We love them. We just know it's hard too. And you know someone who's in this role, please don't go up to them and say, hey, Alex, I know you got a lot going on. How can I help? Because I'm going to shut down emotionally. I'm not going to know what to say. Just freaking fill my fridge, mow my lawn, connect me to a peer, tell me about New York Connects so I can get the support that I need that I'm not going to ever ask for.
Yeah, so people aren't going to believe that you didn't just tee that up for me, but that was all organic. So 22 questions, right? And we're gonna review this again, but as long as we have the opportunity, Kelly's gonna put the link in for the Caregiver Intensity Index. As we said at the beginning, you're not always in the green, you're not always in the yellow, you're not always in the red, but we're concerned about the red and how you go from the red down to the yellow or the green. It takes 2 minutes. It's not just designed for working caregivers. It's for anybody, working or not. But what's most important is once you self-assess, you're connected to resources that can help reduce that stress. Alex talked about New York Connects. That's our online database of community-based services. We have over 70,000 caregiver and respite programs by zip code that's searchable on that tool. To help, but there's also a lot of other resources available. So it's not just assessing you, it's assessing and connecting. And that's what this whole effort is designed to do. So let me go back to you, Dr. Shah. What from again, your experience on the clinical side in looking at the data, what are the most needed interventions from your perspective that can really be helpful for caregivers?
Well, one of the things, what Alex has created is actually magic. Very few things in healthcare are both diagnostic and therapeutic. You know, you get a blood test, you get the results, and then you got to go take a medicine to fix whatever you find. But the act of actually answering those questions is therapeutic. It gives you a voice. It gives you you can say, oh my God, this is me. I get it. This is not normal. And this is why I'm not normal. I get it. I can do something about it. It empowers you. One of the things that Alex taught me was instead of how do I ask about a caregiver? What do I say when I'm in a clinical visit and ask about, are you a caregiver? People are going to say, no, I'm not a caregiver. I'm a mom.
Right.
I take care of my spouse. I take care of my parents. They don't self-identify as caregivers. But if you ask them the question, are you able to take 2 weeks and get away? That's when you'll find out if they're a caregiver. I never thought of that before, but now I've been given the tools to start to understand the opportunities for my patients. And the interventions are clear. We know that some of the benefits of meeting unpaid caregiver needs include improved patient outcomes, improved family experience, improved treatment adherence. This is better than any other drug I can give. And it's not that hard. It's about connecting to our humanity. It's about compassion, dignity. These are things that we are going into medicine for, and very few low-hanging fruits in medicine, right? I can give you this really expensive drug and it'll improve your life by about 4% and you'll live about 14 minutes longer. And that's going to cost you $100,000. Medicaid pays for it, don't worry. I'm sorry, I shouldn't make jokes. But the reality is, this is something that we can do anywhere in the care continuum as providers, as carers, by acknowledging and understanding caregivers. That alone is hugely therapeutic and makes a big difference and can be the difference between life and death, as Alex pointed out.
So if we know all of that, Dr. Shah, and I'm going to give a shout out to Dora Fisher and the whole crew at Haney's who has been working, who has included us in the whole age-friendly health systems. And we just started talking about, again, what's phase 2 look like and the role of caregivers. So, you know, we're going to be working really hard to try to, I guess, you know, not only take the data that Alex has, that I have, but then what you just shared in terms of the clinical outcomes and, you know, your New England Journal of Medicine survey and recommendations, and try to influence that the best that we can. But what are the barriers really for the health systems, and what should our approach be, you know, to try to influence the connectivity of the health systems to this topic?
So, you know, everyone's like, I'm busy enough. It's not my job. Or they think someone else is doing, oh yeah, that's why we have social work. Or they don't understand the opportunity that this is an example of both doing good and doing well. The things that we've done now successfully are things like care coordination and navigation assistance. We know this is important and we target it to the patient. Well, no, targeted the existing program to the caregiver, right? We know this works. Other things like support programs for employees, educational programs, all these things that we built up for patients, we now just redirect them to caregivers, and already we're off to a great start. So that's the simplest thing that hospitals and health systems can do. You're addressing social determinants, well, screen the caregiver, not just the patient. You're addressing financial insecurity, ask the patient about that, because they're the caregiver about that, because they're actually footing the bill oftentimes. I know there's a lot of incredible work done by Excelis Blue Cross in New York, AARP, our friend Steve Aquario, Becky Pareve in Aging New York. All of these folks have been leaders in New York, and if people have questions, they should certainly reach out to them as well, because they're on the ground doing the good work.
I would add to that just really quickly. First of all, shout out to everyone you just said, Nirav, because they're freaking awesome. You're so right. And thank you again. Can't thank you guys enough for what you're doing. It's also, a key next step is to help your own staff, right? Train your own staff by supporting them in their role. I recently had, it's like one of the last times I have ugly cried in public was taking my beautiful mom-in-law, whom we lost, to an appointment where she only speaks Italian. So my man was with me and he was translating for her. They went to sit in the waiting room. They had been told because they were 15 minutes late, they weren't going to be able to have their appointment. She had flown from Sicily for this appointment. The front staff woman was so mean to them. So he's like, Alex, just give up. So I went up and said, she really needs to be seen. We got stuck in traffic. I'm so sorry. The woman was so mean again that I, said, you just need to get the manager. And then I stood in the middle of the waiting room. The manager came out. I started sobbing, like boogers coming out of my face, like hard time speaking, and said, I understand that the woman at the front desk is having a bad day. She's probably a caregiver like me. I get it. But it is not okay to not be kind. It is not okay. Everyone in this waiting room is afraid, right? They're afraid for themselves, or their caregiver who's with them is afraid for them, who they love. And so I would start with that training can start with, let's support our own staff who themselves are so stressed out. They're sometimes really mean to the unpaid caregivers who are coming in. I'm not getting paid for what I'm doing, right? I'm here as the second in line caregiver. And so I think train your own staff, but first support them. Say, we see you in the complexities of your lives. We have resources to support you. We have an employee assistance program. You probably didn't know you need it. We can support you with behavioral health, legal advice. Oh, we also have everything that New York Connects offers. So number one, we're going to help you first. And that's going to create the awareness. So when people come into our health system, you see those unpaid caregivers, you have the capacity to do so, and you have empathy because you know how hard it can be.
Yeah, so I think that leads us right into the project that we have collectively launched here in New York, which nobody else is doing, but that's not the important part. It's getting at some of these different elements. So I'll just quickly describe the project that we collectively launched. And again, thanking the same partners. This is public-private partnership with the Department of Labor, the Department of Health, the Office of Children and Family Services, New York State Association of Counties, the Association on Aging in New York, AARP New York, ARCHANGELS, the Ralph Wilson Foundation, the Health Foundation of Western and Central New York, and so many others. Our Lifespan Respite Coalition, statewide coalition, to do a couple of things. Number one, we know that 90+% of businesses, and we're going to define businesses broadly, that includes state government, county government, local government, and the private sector. That's business in my mind. It's not public or private, it's everybody. We know that 90% of HR departments within businesses want to do more on caregiving, but aren't sure what to do. And that 75% of employees trust the information and advice provided by those HR departments. So we have created a joint caregiver guide to businesses that has all of this information, referrals, telephone numbers, programs, et cetera, et cetera, et cetera. I think Kelly's going to put that in the chat right now so that folks have that. If you are working and you're a caregiver or you're working in general, share this guide with your HR department so that they have the tools that they need to do exactly what Alex just said, is supporting your employees. The second part is to really understand and take this national data, which is scary enough, but understand what's really going on in our own backyard here in New York. So we have partnered with the University of Wisconsin. We have a survey for working caregivers to understand what that role has been currently, whether it be pandemic or not, but what your experience has been, time missing, absenteeism, turnover, things of that nature, so that we can understand better in New York how working caregivers are not only, again, impacting productivity in the business, which I think the business community would be very interested in, because that's a call to action to support them, right? But also the losses. And we know that it costs well over $50 billion a year that businesses lose in absenteeism, turnover, supervision, going from full-time to part-time, leaving work altogether. And then finally, the third is to assess your intensity by using the Caregiver Intensity Index. So if we put these three pieces together, what we're going to be able to do is get some real data about New York, understand the business impact of working caregivers, understand the loss of productivity, be able to educate HR departments and workers in general about what resources are available to them, and then be able to have people actually assess at any given time over a period of time where they are and make those connections. So again, Alex, folks don't know this, they will now. You're a Massachusetts-based organization, and despite you not being, you being the second age friendly and having way less World Series championships than we have, you are knee deep and engaged and supportive of the work here in New York. So what does this mean to you, and what are you hoping to get out of it in a positive way? I don't mean, oh, you're looking to get something out of it, but what does this mean to you?
Yeah, and I know Nirav said this in the beginning too, and Greg, so did you. It means everything to me, everything. Like my kids know this is all I think about, because to me, this is love, right? What we're talking about is the most foundational aspect of humanity, to care for others and to be cared for ourselves. And oh my goodness, has COVID exposed the need for that. And you talk about a public-private partnership. We can't say that enough. This is unparalleled what we're doing. And not only public-private, but Greg, I just got to give a shout out. Usually state government agencies don't work super well with community agencies. You guys are actually really working so well together. You know, your department, Becky, previous department, to make sure that we are not just supporting these unpaid caregivers who are lucky enough to be employed and able to keep that job right now, which is phenomenal on so many levels, but also those who either never got to enter the workforce in the first place or have had to leave because of their caregiving responsibilities. What we want is for every single unpaid caregiver in the state to feel seen and honored in their role. You don't even have to self-identify. We're seeing you. We're creating resources that are valuable for you. Get your intensity. Feel validated. By the way, the CDC study showed that 54% of the caregivers identified in our study were men. 1 in 4 are millennial. 1 in 5 are Gen Z. Throw out your assumption about whether you're not an unpaid caregiver. Take this quick quiz. See if you're in the green, yellow, or red. Feel good about you're not alone in this. And it's going to say to you, here are the 2 things. We know caregivers don't need a long list of things to do. They can't handle it. It's going to tell you the 2 things you can do to most alleviate intensity, and the 2 things that you can do that are most to support what's most driving it. And then pass that along. The more data that we can get, the more we can feed information back to Greg and his team to say, here are the resources that are helping people, but here are places that we don't have enough stuff, right? In this part of this community, in this county, we need more X, Y, or Z. And then the University of Wisconsin survey, please take that, right? Between the 2 of these, it's going to take you no time at all. You're delivering data back to us that we can use to get you more resources, to get better information out there, to truly revolutionize how caregivers are seen, honored, and supported. Very unique opportunity to have an impact. The single most the factor that is single biggest driver of relieving intensity, helping you feel better in your role, is feeling supported, right? And feeling supported starts with you're not alone and we see you, but it's also then take that guidebook that's in the little link here, to Greg's point, print it out or bring it to your HR lead, bring it to your faith-based institution, bring it to your book club, right? It's got a lot of tips and tricks in there that you can use. So I think those 3 call to actions, we want every single human in New York to feel seen, honored, and supported in their caregiver role. We want them to assess their intensity, fill out the work impacts survey. And, I want Massachusetts, obviously I am Massachusetts, but I am okay with New York being first in the nation to really show a state-based approach to loving on every single caregiver that they have, getting them crosswalk to support that can help right now.
And I appreciate that. I'm going to underscore that. So, we do a lot of these educational programs, and I'm looking at everybody out there right now. There is an ask of you today and in the future. It doesn't matter whether you're retired or whether you're caregiving or not. We all live in families. We all have support systems, hopefully, but we have interactions. We have Facebook pages. We have emails. We have kids and grandkids that may be working. Just get this information out. Help us help you. We can't do this without aggregating and having data behind us to show the impact and to do exactly what Alex said. Not only share the assets we already have, but to do gaps analysis and understand what we don't have and what we can do better collectively. So I'm gonna, like I said, I believe Kelly put all of those things in the side. Please help us. That's what this is about today, is not only talking about the issue, but really getting your assistance and getting this out as wide as possible to groups we never thought or think about caregiving, whether it be corrections officers or EMS or police or libraries, healthcare organizations. That's why I really got to put a shout out to Excelis and Emblem, who have been working with us on this, thousands and thousands of employees. Dr. Shah mentioned earlier how to kind of influence and educate the health systems. If we can get health companies, managed care organizations, insurers to send these surveys within their own organizations and see what the impact is on their own employees, they're going to understand a lot better all of the advice that he provided. So Dr. Shah, I'm going to end each with an open-ended question for each of you as we're wrapping up. Is there anything that you either want to reiterate, haven't said, I haven't asked you, any more additional information, advice, guidance that you would give us here on this topic to help move it along? And I'll leave that as an open-ended question.
I would end by just saying, listen to Alex. It's what I try to do on a daily basis, and it works very well. I don't get into too much trouble, but it really is that simple. The index that she and her team have created over the last 20 years, I took it. It took me about a minute and a half. I'm pretty fast with the clicks. But it really opened my eyes too, in terms of how easy it was and how much I could just spread it around. Unfortunately, I only have about 40 people following me on Twitter, so it's not going to help if I tweet that out. But if every single person on this call or who watches this later tweets it out, imagine the ripple effect we could have. So we're getting very close to a tipping point where caregivers are finally appreciated and understood to be so central to our health and our healthcare. And I think we're almost there. And I think with New York State taking the lead as you are, we're going to get there very quickly.
Yeah.
Thanks, Dr. Shah. Alex, same question.
I have to say, I literally at one point when each of you were talking, oh, I want to marry him. I want to marry him. I want to marry everybody. This is amazing. What you guys are doing and how you're doing it is so beautiful. So I'm so humbled to be a part of it. Thank you. We have lots of scars, the 3 of us. And I love that we have found each other and we're doing this for good. I think the most important, the thing I want to leave everybody with is please listen hard and recognize that this is probably true for you or somebody that you love. And the impact on your health is real. And there are beautiful parts of being a caregiver too, right? Extraordinary parts. So we have this phrase that ARCHANGELS, we say, look, love, lift. Wherever you are, look around you, recognize that there are caregivers everywhere and they don't always look like what you would expect. Take a minute to love on them for what they're doing. Start with yourself. Hey, self, thank you for what you're doing. And then give them a lift. And that lift can be as straightforward as, I see you. Thank you for what you're doing. Everybody who's on here right now, find a caregiver to thank. When we get off right now, FaceTime them, text them, email them, call your mom, call your brother, whoever it might be. I see what you're doing in your role. Thank you so much. And do something to support them. And then pass out that link. Because again, the process people go through when they understand this is true for me can save lives. Nirav said that earlier. That sounds dorky. I always feel dorky when I say it, but it's true. People are struggling. And what they're doing is beautiful. And we have an opportunity to lift them up by recognizing what they're doing. And thank you. This is a lift for me. I'm so grateful. We are so grateful. All of Archangels is so grateful to be part of this. Thank you. Thank you.
Well, I appreciate both of you. This is the beginning, not the end. So we look forward to our continued work together. Share the resource guide, take the caregiver, working caregiver survey, take the caregiver intensity index, share it with everybody. Take the time, as Alex said, to take care of yourself. You're not good to anybody else if you're not taking care of yourself. We want you around. We want your loved ones around. We know how important you all are. So again, I want to thank Dr. Shah. Great to see you. Stanford University, used to be the health commissioner in New York. Great to have you back. Alexand Drane, Archangels and Rebel Health. It's been an absolute pleasure. I have to thank Kelly Matija, who is by my Wizard of Oz behind the green curtain that makes all of this production happen, does a fantastic job. We are taking the month of August off, so we'll see you back in September with a whole new Facebook Live series. But again, thank you guys so much for joining me today, and we'll continue to plug along. Thanks. Have a great day.
Thank you so much.
Thanks.